I would say the glory in the story is that even though these experiences did not feel good and was painful enough that it caused me to have some tears, I learned that through these painful experiences that God has been able to use my voice and shift it to purpose. It is ultimately my hope that my story shows others who have had similar experiences how to create their own glory. Hello, listeners. Welcome to the You Belong in Here podcast. This is a podcast where we explore the intersection of nursing and racism, racial disparities that African Americans face in healthcare, as well as the inequities that African American nurses, doctors, and nurse practitioners face in the workplace. My name is Dr. Tiffany C. Brown, and I am your host. I am a doctoral level nurse practitioner with more than 23 years of practice in the nursing profession. It is my hope that through hearing the personal stories of triumph and resiliency shared through in-depth interviews from nurses, nurse practitioners, doctors, and DEI experts, you will be empowered in your workplace and know that you belong in here. Now, let's get to our show. Hello, everyone. Welcome to the very first episode of You Belong in Here podcast. My name is Dr. Tiffany C. Brown, and I am your host. Given that this is the very first episode, I thought I would use this time to introduce you all to the concept and the foundation of this show. This I will call my why. So ultimately, my why comes from a place of my lived experiences with racism as a nurse and as a nurse practitioner. So I decided to tag the title to today's podcast episode, Silent Frustration, when nursing opened my eyes to racism. So as you've probably gathered from this title, today I'm going to be talking about racism in nursing. So if you are a nurse or a person who works in healthcare or a person experiencing racism in the workplace, this episode is for you. In my conversations about racism, I will be using the American Nurses Association definition of racism, which is defined as assaults of the human spirit in the form of biases, prejudices, and ideology of superiority that persistently cause moral suffering and perpetuates injustices and inequities. So, as you can tell, it's kind of deep. No one likes to read a definition of racism, but I actually like that one. So let's get into it. So I want to start with, again, my decision, my why. Why start this podcast? Why do something like this? And I'm not going to lie, I did even inquire to myself, who is going to want to hear this? Who is this podcast going to be for? But again, that even makes me think back and go backwards to my why and my genesis about even why I decided to become a nurse and where I started my education and what those experiences were like. So yes, my genesis or my beginning starts with my education. I received my bachelor's of science in nursing degree and I graduated from a school in Michigan in 2000, December 2000 to be exact. Then later went on to study to become a family nurse practitioner and I got my doctorate in nursing practice degree. I was doing those both at the same time and I graduated in May 2020, right on during the pandemic, beginning of the pandemic. Now in that in-between time, I did decide to go to seminary and I studied theology. And so I got a degree there as well. And that was in my master's there and that was in 2014. But while an undergraduate, I was studying a school that had 27,000 students and only 2% of these students were Black. Now that 2% in total was about 540 students. Surprisingly though, it wasn't there that I encountered racism. That did not actually occur until my very first day out of orientation on my first nursing job. At the tender age, I would say, of 22. So let me tell you a little bit more about it. Like any other day, I arrived at work and I sat down at the nurses station in a workroom to get report from the outgoing shift nurses. Now, following that shift report, I went into the patient's room and I introduced myself as Tiffany. I'm going to be your nurse for today. I'm here to help you. But after the introduction, I was shocked and surprised by the patient's response to me. And the patient said, "Oh no, I do not want a Black nurse. What happened to the white nurse that I had yesterday?" I was stunned. I was shocked. I could not believe that this had come out of this patient's mouth, mostly because no one has ever spoken to me that way. No one has ever directly said to me something about my race, that I was Black. And that was the reason they did not want me to be their nurse at that time. at that tender age of 22. So given that I was the only Black nurse on the unit that day, I did leave the room and went to discuss the situation with the charge nurse. And she ended up reassigning the patient to another nurse who was white. When my manager got in about an hour or so later, I did step into her office to discuss the situation with her as well. She did express a little bit more support and was more, and also shocked, just as shocked as I was. I think sometimes racism to those who experience it directly is a shocking thing, but then also I have found when I share these experiences that I've had with others that I would call allies, they're also shocked that it has happened as well. So my manager, she was shocked, but even though she was shocked, nothing really happened. I don't recall that she went into the patient's room and discussed with the patient that we don't tolerate discrimination here at this place, at this hospital. Oh no, we don't do that here. Nothing seemed to have happened. So I recall just continuing the day and going on, seeing the rest of my patients and completing my work day. And I drove home. And when I had time to reflect on the drive home, I remember I cried a little bit because again, this was the first time I had experienced racism. It happened going in to help someone, and it happened for me being a nurse. And I was so excited at that tender age of 22 to start my career as a nurse. So I was so excited to give care. And then this whole disappointing incident happened. Unfortunately, what I didn't know then was that that was not going to be the only time I experienced time with a racist patient as a nurse or a nurse practitioner. And I was confronted with racism with patients more often than not. However, from that first experience, I realized I did not have a safe space in my workplace to discuss or share these issues with others because, as I mentioned before, I was the only Black nurse working that day. So I could not go and discuss this with someone else who might have been Black, who might have been able to say, girl, I understand what happened. That happened to me. Or no, I didn't have anyone to talk to about that. And I didn't feel safe enough, especially as a new nurse, as a new grad, talking about it with some of the other senior nurses who were working that day. And they were older than me. And, of course, they were not Black. I recall talking about this incident about 2021. So about that time, I went to a magnet conference. It was in Atlanta, and I sat in on a session about bias in healthcare. Now, mostly these sessions are these bias sessions, that is, discussions are aimed at the healthcare team and the healthcare team to recognize their biases when managing patient care, as we manage patients' care too, I would say. But at the end of this session, I stood up at the mic and in front of hundreds of people, because it was a large session. That one was, I think, about 200 people, probably or more in that room. But I stood up to the mic because sometimes after a presenter speaks, there'll be mics, in the aisles where people can go and ask questions or give comments following the presenter's presentation. So I stood up at a mic, and when they came to me, I said, I don't know why or how these words came out, because when I stood at that mic, I did not know what I was about to say. But I recall saying these words: I am so frustrated. And in this crowd, I shared a portion of my experiences with racist patients, and sometimes some of the experiences I experienced with racist colleagues. I had the opportunity to just open my mouth and share some of these experiences that I've been holding in for 20 years. And at the end of me speaking about what had been happening to me and what I had not shared with anyone else, I was in tears, but I also felt finally a release of emotions, because I had never released those emotions. I had never spoken publicly or shared or had any discussions with other, Black nurses about any racist events that they had been experiencing or any stereotype or bias experiences that they had been having. So it was just never really discussed. At the end, I did return to my seat, but what happened next was pretty shocking for me. Those who go to conferences sometimes can understand this, because at the end of the session of a conference, the presenter usually would come down and stand, and people will come and talk to them, come up to them, ask them questions, and congratulate them, or usually maybe it'll be a line. However, when I returned to my seat, there was a line of people waiting to talk to me. Now, most of them were Black nurses, but there were other nurses there that stood in support and said some encouraging words to me as well. The Black nurses, they ultimately shared some of their experiences as well and said, me too. So it became like this Me Too moment that took place that day in September 2021 at this conference. But I thought to myself, wow, for the first time, I did not feel alone in my experiences and in my thoughts. I thought to myself, how many other nurses or Black people out in the workplace sit around silent with frustration and not having a safe place to speak about what they're experiencing, or not feeling the courage or feeling bold enough to say some things about some of their experiences, or don't have the support, that they should to discuss these experiences. Because I've tried to find purpose, hope, and glory in most things, I thought to myself, where is the glory, hope, and purpose in this, the racial experiences that I have experienced? I would say the glory in the story is that even though these experiences did not feel good and was painful enough that it caused me to have some tears, it's been though I learned that through these painful experiences that God has been able to use my voice and shift it to purpose. Hence the concept of this podcast. It is ultimately my hope that my story that I'm sharing today, briefly sharing today, because there are more, unfortunately, that my story shows others who have had similar experiences how to create their own glory. I also hope that my guests who come on and share their stories, which won't always be, their story is not my story either. Their story will be their story. But this podcast will give people a voice to share their experiences and also encourage others where they can create their own glory as well. I would like to share some important statistics with you. On January 25th, 2022, the National Commission to Address Racism in Nursing released the results from a survey of over 5,600 nurses, with findings showing that racism is a substantial problem within the profession. From this survey of 5,600 people, 63% of the nurses surveyed say they have had personal experience of racism, an act of racism in the workplace, with their transgressors being either a peer, patient, or even a manager or supervisor. 57% of these nurses said they have challenged racism in the workplace, but more than half said their efforts resulted in no change. So it made me think too, even, having a voice is important. Speaking up is important. But if we could see over half of the nurses that may have spoken up and challenged racism in the workplace didn't see anything. But this is for the organizations that are out there. What are we really doing? What change are we really working on? What change do we hope to see? Are we putting Band-Aids on these things? So I hope they're listening. Over half of the nurses surveyed from that 5,600 say racism in the workplace has impacted their professional well-being. This kind of helps me to aid me to think and go into another thought process with regards to racism and its effect on our mental health. And that's a topic that we'll definitely be talking about in this podcast as well. So why am I sharing this information, you may be wondering? I hope this information informs you that you're not alone in your experience, even if you think you are. So what is the solution, right? I would boldly like to encourage you that the solution begins with confronting individual and systemic racism in nursing. What does that look like? Well, years after my experiences with racism, I later realized what should have happened when that patient stated so boldly, she did not want a Black nurse. But I also have had other opportunities, as I said before, to learn how to address patients like this. My addressing them comes from an anti-racism perspective, and I will give some links in my in the show notes so you can find those things there as well. But from them, I want to give you 3 pearls of wisdom to take away, and hopefully they will help you as well. First, I understood my right to be respected in the workplace, and disrespect from a patient should not be tolerated. When it has happened again after that first time, and when I've gained some wisdom to understand that I can say something, I can speak, I have since informed the patient that their comment is not acceptable, or that your comment sounds disrespectful. Second, when a patient has made a comment that lends me to believe it is a racist statement, I have asked the patient, what do you mean by that? Now, what I love that question. What do you mean by that? And watch, you guys are going to start using it even in your regular conversations. Number one, it helps to give clarity to what the person is trying to say to you. It gives you the opportunity, or it gives them the opportunity to restate what they really meant, or let them know that you could possibly not be understanding what they're saying. So I love asking a patient if they say something that sounds funny, because it could be me. It could be me. I mean, I'm guilty of it being me and misunderstanding people when we're communicating. All these things are just helpful so that we all can communicate a bit better, especially with such a sensitive topic. Thirdly, I have spoken up and reported discriminatory behaviors that have occurred with patients or colleagues to human resources by way of writing a safe report or discussing them with management and going to them for their guidance in how to handle the situation. I have found that to be helpful in multiple situations. And we probably would talk about those things as well. Well, folks, ultimately, I want to give you a little quick synopsis of what this show is about. And as you can tell, we're going to explore some previously uncharted territories in this podcast. Discussions about racism and racial disparities in the healthcare system affecting the African American community, as well as experiences of African American providers and nurses. These are all challenging conversations, but I believe they're essential. I believe they're essential now more than ever. I believe it's imperative that we begin to engage in these conversations. This podcast will mostly consist of interviews with African American guests and even some allies in the healthcare profession. But honestly, this show is a show for everyone. So I hope everyone tunes in. Now, I do welcome audience participation and would love to hear your thoughts about some potential topics you all would like to hear discussed on the show, particularly regarding healthcare, healthcare disparities, and sharing your story if you want to. And maybe we can have you on as a guest as well if you're a nurse or someone in the healthcare profession or know someone who is one of those things in healthcare or a DEI expert. Please refer them to the show and refer them to me, because I would love to talk to them. Well, everyone, this concludes the first episode of You Belong in Here. Thank you so much for tuning in. Everyone listening or watching today, I hope this show will encourage you, inspire you, and empower you on your personal journeys in the healthcare field, knowing that your presence is necessary and you belong in here. If so, again, like it, subscribe, and share it with others. You can find my podcast on Spotify, Apple Podcasts, and my website, belonginherepod.com. I will post every other Wednesday, so twice a month. You can follow me on IG, You Belong in Here Pod, where I will also post alerts as to when the podcast will be launching. So tune in 2 weeks for the next episode entitled Leaving the House with Your Whole Armor On, the Black Nurse and Mental Health. Until then, take care and keep pushing forward, everyone.